Hi, everyone. My name is Sheila Murphy, and I'm Vice President of Advocacy Programs and Initiatives at Research America. I'm really happy to welcome you to our 2025 National Health Research Forum. And for 30 years, this forum has served as an opportunity for medical and health researchers and advocates and patients and everyone else to come together and discuss issues that are most important to our ecosystem. Before we begin today's program, I'd like to extend a special thanks to our National Health Research Forum sponsors for their contributions to this year's event. Johnson & Johnson, Amgen, Pfizer, Genentech, Cencora, the American Society for Microbiology, the Association of American Medical Colleges, Eisai, Elsevier, Lilly, Picori, Pharma, and Ultragenyx. And I hope you've all had a chance to spend some time in our virtual environment where you can learn more about our speakers and other 2025 forum programming. And then please also join us on social media today using the hashtag RAForum. I'm very excited to introduce today's discussion, The Evolving Federal Landscape for Medical and Health Research. And we're really fortunate to be joined by two great speakers, both of whom need very little introduction, so I'm not going to go on too long. Our moderator today is Dr. Julie Gerberding. She is President and CEO of the Foundation for the National Institutes of Health, which is a nonprofit that builds public-private patient biomedical research partnerships to address important medical challenges in support of the NIH. Julie is joined today by Dr. Sudip Parikh, who is President and CEO of the American Association for the Advancement of Science and the executive publisher of the Science family of journals. In addition to so many of their accomplishments, Research America is privileged to have both Julie and Sudip serving on our board, and Sudip is our current board chair. So without further ado, I'm going to turn it over to you, Julie, to get started. And thank you again for joining this session of our forum.
Well, thank you, Sheila, and I am absolutely thrilled to have a chance to have this conversation with Sudip, but also to engage all of our audience, the stakeholders in science who are making time to participate in what I think is a really important opportunity to explore not just the current situations that we're facing, but also the long-term view. I can't think of any person more qualified to be a part of this conversation than Sudip. Many of you know him as the CEO of AAAS, but he has a long and very complex career, having served as a research scientist with a PhD, a policymaker in the Senate Appropriations Committee, as an executive at several organizations that were responsible for entrepreneurial innovations and their translation. And most recently in his current role, not only as the most senior spokesperson for science in so many parts of our ecosystem, but also as an incredibly effective communicator and advocate. So Sudip, because we're talking about science and support for science and the role of science, I'm just going to spend a little minute here talking about your scientific journey, because I think it illustrates the value of some of the things we're talking about. Sudip's family immigrated to the United States. He grew up in North Carolina, went to UNC, did a presidential management internship at the NIH, a very important federal program for supporting emerging science and policy experts. But he also received a National Sciences Foundation grant at Scripps, where he got his PhD. He has been a very effective policymaker. That's where I first got to know him, when he was serving in the Senate Appropriations Committee on the Republican side for Senator Specter. He and I had wonderful conversations about how to support the CDC in those days, but we also were advocating for a broader health agenda. Everything from field hearings in Harrisburg, Pennsylvania, to riding on a C-130 into Afghanistan in the middle of the night to advocate for a pause in fighting so that we could support the polio immunization program. So I have highest respect for Sudip's overall and long-term commitment from science. But Sudip, you've really, in a sense, been a beneficiary of the investments that our country makes in research, as well as the champion for sustaining and elongating those investments. So tell us a little bit from a personal perspective how you see where we're going with our leadership in this space.
Yeah, thanks for that, and Julie, I'm really humbled to hear all that because it doesn't feel like complex is the right word. Complex in the sense of wow, that is that's there's no way I would have planned that journey. Uh, my parents are immigrants to the United States, and they are they were a part of chain migration. So my uncle was a geologist who was recruited to work at NASA, and he worked at Goddard during the Apollo missions. But my parents were here because of chain migration. They worked in factories in North Carolina, and there are so many stories like this throughout the sciences and elsewhere, both of children who grew up in places that are outside of our places where elite research takes place. Either they're born here or they immigrated here, and then they found a path through programs that were really created by the federal government to get people into the sciences. My very first job as an undergrad was as an IRTA, an intramural research training awardee at the National Institute of Environmental Health Sciences. It's a program that brings young undergraduates into scientific research. That PMI program, the Presidential Management Intern Program, that was an extraordinary program. I hate to say that it was canceled earlier this year, and it was a program that brought people with advanced degrees into the government. I had no idea how to actually get a job in the federal government. It's hard, I didn't know how to do it, and the PMI allowed you to do that. The National Science Foundation Graduate Research Fellowship that I had when I was a graduate student went from 2,000 awardees in 2024 to just 1,500 in 2025. And that was only after a huge pushback on the fact that it had been cut in half, down to 1,000. Now, these are I remember thinking the graduate research fellowships are just extraordinary in the breadth of sciences they cover, from the social sciences to the physical sciences to the biological sciences. And it was a place for young scientists to get to know one another and create long-term collaborations that last 40 years. So those things that were part of my career, as I see what's happened to some of those programs, it really bothers me. And I was really glad to see that the advocacy for the National Science Foundation Graduate Research Fellowship did actually put the numbers back up. And it tells me that advocacy works. It also tells me that we are in a time when we have to remind ourselves and remind the nation of why those programs are so important to our competitiveness and to the overall prosperity of the country.
Thank you for that. And I'm sure a lot of people have been inspired by, understanding how you started and where you are today, Sudip. It's really a remarkable experience. We're all kind of in an environment where on any given day, we may be facing a crisis or a chaotic situation that we don't have clarity on. But it is also really important, and probably one of the hardest things about being a leader, to maintain that focus on the long term, the important strategic imperatives that we need to accomplish for our long-term success. It's easy to get distracted by the crises, but you have been really a champion of making sure that we sustain a long view. And the product of some of that energy is something called the VAST, which is a vision for America's basically ongoing leadership in science and technology that came out earlier. But I think it's worthwhile revisiting the VAST a bit, Sudha, because we must maintain our focus on the long-term strategic imperatives. And maybe you could sort of start by just telling us why the VAST, why this. So many people felt this was needed. I know you assembled a wise crowd to really work on this over a long arc of time. So give us a little bit of background and the genesis of it, and what you hope to accomplish.
Yeah, there was just even in the last 5 years, there's just been this feeling in the scientific community that it was time to reclaim the narrative about what the scientific enterprise is. We even when I first got to AAAS in early 2020, there was a gathering at the National Academies talking about the 75th anniversary of the Endless Frontier, which is really for those of you who don't know that work by Vannevar Bush and his letter to the president back in 1945, it really set the tone for what the American enterprise is today. And it only had probably three pretty simple recommendations, but they had profound consequences. I mean, the consequences are they really built the modern world. All the science and technology that we depend on, this idea that we should be investing in science in a time of peace, just like we did in a time of war. The idea that science research should be done at the same time as education. That wasn't a given. It's something that came out of the endless frontier, and the idea that basic research was really important, and that there should be this collaboration between academic scientists who are doing basic research and folks who are doing translational science and folks who are getting products out to industry. But that model was built and it was written in 1945 in a time when the United States had no peer nations at all, when the talent was mostly domestic talent, and in a time when the federal government was the overwhelming investor in basic research. And we look at today, and all those things have changed. We do have peer nations who are investing in a model very similar to ours. We do have a time when infrastructure for science, big infrastructure for science, is sometimes held in outside the federal government. At the time in the 1940s, everything that was going to be a huge investment of infrastructure was sitting in the federal government. You had the national laboratories or large infrastructure projects from the National Science Foundation. Today, if you're looking to build an LLM, you're not going to do it on a government computer. You're going to do it at Microsoft or at Google or at OpenAI. And so we have these profound changes that have happened. And so there's been a conversation ongoing in the scientific community to say, isn't it time to sort of get off the back foot of defending what's here and really thinking about the future? What are the changes, the profound changes that have been built on top of the Vannevar-Bush model? What are the implications of that? What should we be doing to think about the future? How do we reclaim the narrative? How do we once again become the protagonists of our own story? And so a group came together and really spurred by David Spergel at the Simons Foundation, who really said, it's time for this to happen somewhere. If we can't find a place for it, let's just create it ourselves. And I was humbled to just take part as a chair, having to pull the group together. And it was really wonderful. I asked 71 people to join this effort, from extraordinary scientists, CEOs of companies, to graduate students and postdocs and assistant professors. And 70 of them said yes. And one said that she couldn't because of family obligations, but she would review it. And then, I never have that kind of success recruiting people to things, but people want to think about the future. They want to talk about what's it going to take to build on the successes that we have today. And that group got together, and they're a busy group. And so we got together late at night, sometimes 9 o'clock at night on Zoom, over and over again, and really had wonderful conversations. And I got to tell you, I miss those. For the folks who were on VAST, I would get folks together and would have, if you wanted to bring a glass of wine or a drink or something to have that engagement. It was really a terrific opportunity, and to watch graduate students talking to the president of the National Academy about the future of science was a real privilege. So, and what came out of it was a really short document. It's basically 6 pages that talk about where we are today, the why, talk about the narrative that we needed to reclaim, and what science can do for the country and for the world, and then making a series of pretty broad recommendations that really need to then be built upon later in more detail in all the different disciplines. And they are recommendations that transcend political boundaries. They're recommendations that transcend the politics of today and really think about the future. And I hope that we're going to continue building on them. I know I'm committed to doing that. I know others are as well.
So Sudip, one of the things, and you just mentioned this leadership concept, or the global leadership, peer nations that are now benefiting from models similar to ours or in direct competition with us. And of course, one of those conspicuous competitors is China. As I think the VAST report indicates, that as the share of global research and development investments, we are no longer the only leading nation in that space. China is rapidly catching up. And if you just look at it as in terms of percent of GDP invested in R&D, our percent of GDP is declining, whereas China's is on a very rapid trajectory, poised to overtake us in the not distant future. So, we hear this in the news every day. We understand the tensions and the competition. We also understand in the context of something like COVID that there's a need for some kind of global engagement and to recognize that we actually are all in the same spaceship together. But really, from the standpoint and perspective of this audience, why does this matter? What's really at stake? So what if China moves ahead? What's at stake for the U.S. or for our scientists in this sense?
Yeah, I often say that, if there's a cure for Alzheimer's or a cure for Parkinson's, and it comes from Beijing or Boston or Brussels, I'm okay. I'm going to take it, right? I'm gonna celebrate it. I'm going to be really excited about it. But as an American, as someone who wants to see the enterprise here continue this amazing virtuous cycle that we've created over the last 80 years, where if you have a success in the sciences and it builds upon itself, and it leads to productivity growth, and that productivity growth enables you to invest more in science. It's a really powerful cycle that we've created. And when you break it, the benefits of that virtuous cycle accrue somewhere else. And then what that does end up doing is hurting us economically, hurting our national security. And what I think, especially for this audience, but especially for me personally, is it hurts our health because we're no longer the standard setters. We're no longer the ones prioritizing, we're following. And that is a very different world and one that none of us have experienced in our lifetimes. And I don't think we want to.
But I know our audience can find best. I think the link just was put in the chat, so I won't go into great detail in what is in this very thoughtful document. But the three main buckets of engagement are really improving the efficiency of research and breaking down some of the barriers from a policy perspective. The workforce issue, which we've already begun to touch on a bit here, but that's both a long-term as well as a current urgent priority. And then the need for strategic investments. You mentioned kind of the biosecurity and health protection dimension of that, but we're in our model and its strengths include the fact that our research is highly distributed. It's based on independence, entrepreneurial, free agents. I mean, obviously funding has to be qualified and earned, but nevertheless, people are pretty free to pursue whatever avenue of research they're interested in, and that's paid off. But it's not necessarily strategically designed to optimize the efficiency of the spend. So how do you really see that balance coming together in a better way going forward? Because I think that's some of what's driving the opportunities from those who are cutting things in our research enterprise. They see a need for more efficiency, but we haven't really replaced that with something that's constructive and actually will get us to a more efficient, more effective investment platform.
Yeah, there are places. The VAST report is really I think pretty eloquent about this. There's some things that are just tactical, right? We needed to make sure that the R&D tax credit didn't have to be amortized over a certain number of years. That got taken care of. We want to reduce the burden on scientists. We don't want a scientist who was supposed to make her Nobel Prize winning discovery that night instead filling out a travel form. Those kinds of things. So those are the tactical. But when you think about the question you just asked, which is a much bigger question, which is how do we prioritize? How do we balance the basic, sort of entrepreneurial research that is curiosity driven with the need to overcome certain barriers to economic growth? So, for example, on the energy side, we have technologies, right? We have solar and wind and nuclear and fossil fuels. And how do we balance that? And how do we build an electrical network that is and transmission lines that are built for that purpose for the next 50 years? Because that infrastructure has to last a long time. That's a very applied set of research questions that require batteries and it requires higher efficiency solar panels and that sort of thing. And so there are goals that you can set, national goals, and you can look to see, are there collaborations across the various funding agencies to make those happen? What you don't want is an uncoordinated effort to get to the best battery. You want to see that across government. But then there's a real need to say that, we're gonna pursue that, but there might be a better way altogether. And we see this in the biomedical sciences all the time. The classic example is polio and iron lungs versus vaccines. But we see that in other ways as well, right? We know that there are ways to treat sickle cell anemia for a lifetime. And they have many, many drawbacks. Or there's a way to through gene editing to really provide a cure for the rest of your life. We have to be able to balance both those types of research. And I look at it in terms of a portfolio. It's like my 401k. I want to have some things that are about the applied. I want to have some things that are about the discovery that might change everything. When I testified to Congress recently, and I was asked sort of what are some of the things in basic research that really changed the world. Of course, everyone wants to talk about CRISPR. It's an amazing discovery that if you had asked the scientists, the young scientists who are working on sequencing bacterial genomes, if you had asked them what the application for this was, probably their best answer would have been to make better yogurt, right? I mean, there wasn't something that you could have pointed to, and you certainly couldn't have pointed to the idea that it was going to lead to the ability to do gene editing in humans. And that's an extraordinary leap. And you can draw the line backwards. You can't draw it forward. And so we have to be able to have a portfolio of investments. And that's what's amazing about the community that is part of the Research America Alliance is, we have in this alliance, we have folks who are doing basic research at institutions. We have patient organizations that are then creating the why for why we do this work, but then also in a very sophisticated way saying, we see all that basic research out there. There are some areas that maybe if we invested a little bit more in understanding the ribosome, that would help with my disease. Or if we invested more in the mitochondria, we'd be able to understand my disease. And then we have industry as part of this alliance as well, where to get to the scale necessary to actually provide treatments to folks, you have to have that. We have members like Picori who are thinking about what is the best way to get to outcomes. So that's the power of the alliance, and I think it also speaks to the kind of work that we have to do in balancing a portfolio.
This idea that we need some kind of organizing process to say these are our national priorities. And by the way, that is something that China does very well. When they decide they're going to go after X, it's all hands on deck, and they can really focus and get there. I'm not proposing that I want to live in China, but I'm just saying that there are advantages to having a prioritized agenda and getting that balance right, because in no way, shape, or form should we abandon the discovery, curiosity-driven research. But all of this takes resources, and an environment where our resource base is shrinking. We have to deal with the national debt. Anybody who doesn't understand that needs to go back to second grade. But what I was really, in a sense, relieved when I saw Research America's poll of Americans earlier this year that 90% of Americans really believe that the United States should be a global science and technology leader. And at least 3/4 of them believe that R&D investments actually do drive jobs and employment and prosperity in our country. Most people would even be willing to pay $1 more a week to support biomedical research investments. And at the same time, through other measures, we see declining trust in science and a growing inability to discern what's truth and what isn't truth, decisions that are based on beliefs rather than on evidence. And I think ultimately the fact that 80% of Americans believe that we have a great deal of concern about mis and disinformation really is kind of the way that all gets tied together. So here you are, the executive responsible for the family of scientific peer-reviewed journals that science publishes. What do you see as the opportunity, or I guess the agenda for how we're going to crawl out of this deep hole of mistrust in what we're doing? Because in order for people to be willing to invest, they have to believe that we are the right people and that this is the right agenda to get what they think they need.
They do. I think it starts just with being humble. We are we spend so much of our time as we go through this training process, right? We go to universities, and then we go into graduate programs, and then we go directly into these research institutions. And every step of that takes us just a little bit farther away from the community in which we grew up, from the community in which we're really trying to serve. And it's hard. It's hard to make that connection back, particularly when we are in a time that is not a crisis, in a time when there is some normality. How do we build bonds during that time so that when there is a crisis, there's a level of trust? And what I've found is that we made a huge number of mistakes, and COVID broke us. I can't say this. I can't say this more clearly. COVID had the effect of really breaking so many things in our society. And part of it, science has all kinds of things that we can celebrate. I'm not at all ashamed to celebrate what science did during that time. I look at some of the covers of Science magazine, and I look at the success of Operation Warp Speed, and I am in awe. I am in awe of what science did. I'm also, in some parts of that conversation, I'm kind of disgusted with what we did. The biggest one I can tell you about is, I watched a moment in time when we lost someone who could really be a real partner to the sciences. I'll give you an example. At Science, we reach 6.2 million readers a week, which to me sounds like a lot. It sounds like a lot, but Joe Rogan reaches 100 million listeners a week. And there was a moment in time when Joe Rogan got COVID, and he did what my parents did. My parents, when they got COVID, yes, they went to the doctor, and yes, they got Paxlovid, but they also, they took some turmeric powder, and they did some of the home remedies that I remember them using on me as a kid, and they did all those things, right? And they threw the kitchen sink at it. And Joe Rogan, in his own way, did the same thing, including using ivermectin. Now, there's a whole bunch of data out there that says that ivermectin didn't have the outcome and effects that we wanted to in treating COVID. That said, it is a real medicine, and it is on the market, and it is used in humans. But there was a tweet from the FDA that said, stop using horse medicine. The same week, the exact same week. And so I see this place where, we've got to be as humble as possible. We've got to be as honest as possible, as clear in our communication as possible. And so as we're trying to dig out of this, I think part of it is having discussions, being willing to engage in long forums with folks to start to rebuild trust. And that's going to take time. And there are plenty of bad actors out there who don't want us to rebuild trust. So we have to recognize that and know that there are folks who are just trying to do damage. But there are folks who are of good faith, and we have to be willing to engage. And I've seen some of that in the scientific community. I've watched folks who were involved in our COVID response. I've watched folks who were involved in our public health response do that in a way that really gives me incredible pride. And I want to see them supported as much as possible. I also think it's amazing what early career scientists can do. The ability to build bonds that are going to last a long time. For those of you out there who are in the early stages of your career, this is the time to do that. Build long-lasting relationships inside and outside the sciences. Because if you're gonna go to someone, you're gonna say, "Please don't sing in church today." You can't do that having never seen them before. You have to have a relationship over time. And I love what I'm seeing with this next generation of scientists. They see that. They see some of the challenges that occurred throughout COVID. And what's amazing to me is, it's not just COVID, right? I mean, it's not just public health. I see this in other parts of science. There's a raging argument going on in the community around superconductivity. They're at each other's throats almost as much as folks who argue about lab origin versus wild origin of COVID. It's just that one is not a very public battle. We scientists, we argue. That's what we do. We want to make sure that folks understand that scientific process while we do it. And the only way to do that is to build bridges into the community.
So you're kind of helping me transition from kind of that longer term, where do we need to be, broadly speaking, and long term, to like the urgent things that are in front of us. And clearly trust and communication is urgent, and it's also long term. Yeah. But one of the things that has to be on top of mind of everyone who's listening to this is what's happening with the budget. And you are uniquely situated to understand what the current outlook is from the Senate and the House side for the more immediate budget process. So you can just update people on what you know and what you can project with your crystal ball.
Yeah, I'll happily do that. This all started, to go back just a little bit. I remember having a conversation in February of this year And we're just starting some of the chaos that's happened over the last 6 months, and Doge was just starting to do its damage across the science agencies. And I remember talking to folks about the fact that really we had a really important battle coming up, which was March 14th. March 14th was the day that the CR, the continuing resolution for fiscal year 2025, ended, and there needed to be another continuing resolution. And there was a lot of room there for damage to be done. You could do anomalies that would reduce the NIH budget or the CDC budget or any other federal funding agency. And that would then be built into the baseline, and it would be almost impossible to get it back. And I remember describing that as Dunkirk and saying that if we lost Dunkirk, then you don't have the rest of the battles to fight. And we, through advocacy, through really intense advocacy, that CR came out in a really good place, which was the Congress basically flat funded the funding agencies, NIH, CDC, all of them. So from the congressional side, it was in an okay place. That wasn't by accident, it required advocacy. Now, since that time, we were going through a whole bunch of issues related to, will those dollars be spent? Will they be spent by the administration? That is still being worked out. And I will tell you that we've gotten commitments from Dr. Bhattacharya at the NIH, from the NSF, that they are going to make those investments this year. We have to hold them accountable for that. And so I'm going to keep asking that question. I know all of you will as well. And we saw that Congress also made sure that they understood that this was a priority for Congress. I watched as 14 Republican senators wrote a letter led by Katie Britt to the Office of Management and Budget asking the OMB to ensure that NIH was able to spend its money in fiscal year 2025. Now that led to OMB saying, oh no, we're not going to spend that money. And that then led to a turnaround within 4 hours. That was advocacy. That was advocacy and raw political power ensuring that those dollars are going to be spent. And so where we are today is that for fiscal year 2025, we had flat budgets going in. There's been a whole bunch of damage that's been caused by termination of grants and cancellation of grants at certain universities, but the dollars have to be spent. Congress is looking, and so is the outside community. NIH has said they're going to do it, and I've seen them forward fund grants, which is actually a challenging thing for us because it means that the total number of grants going out will be smaller, which means that pay lines are much, much lower. We have to work on that. Now, in seeing those problems, we've seen a huge amount of advocacy in front of the Senate and the House for fiscal year 2026, which begins on October 1st. We're almost there. And that advocacy led to protections against that sort of thing in the appropriations bills that have been drafted by the House and the Senate. So the Senate bill that funds the NIH includes language that does several things. One is that it limits the use of forward funding of grants. And so this is important because it enables more grants to be funded in a given year. The second piece is that it provides a limitation on implementing a cap on indirects. Indirect costs, and we can get more into that later, but that's a really important piece of language that is protective until a new model is put into place. And then the third and most important thing that the Senate bill does is it does not reflect the president's recommendation for huge cuts to NIH. Everybody remembers that the president's budget recommended cutting NIH by over 40% and reorganizing it completely. The Senate bill provides not a cut, it provides an increase of $400 million over fiscal year 25. That's extraordinary. If you think about where we started in February of this year to where we are today, and the Senate is providing a $400 million increase. What's even more extraordinary is that the House, which is, again, this is a Republican majority in the House, not only rejected the president's budget recommendation of a 43% cut, it includes a $100 million increase. Now, if you had told me 3 months ago that the House of Representatives was going to come through with a $100 million increase to National Institutes of Health, I would have said you were nuts. But you know what? They did it, and they did it because of advocacy. They did it because of advocacy. And I've seen this across the spectrum. And it is advocacy that is both, the talking point, which is really important, coming from scientists and institutions and organizations like the AAAS and Research America, but also from more political parts of influencing. We can talk about that later as well. That's really amazing. So now we're at a place where the House has a $100 million increase and the Senate has a $400 million increase. It's not the end of the story. We're right in the middle of it. And so advocacy has to continue. We're approaching September 30th, which is the end of the fiscal year. They're not going to pass appropriations bills for NIH and the other science agencies by then. There will be another continuing resolution. That continuing resolution needs to have protections for spending the money for NIH. And so we're all advocating for that. Then we have to get to hopefully an omnibus package sometime toward the end of the year. We want to see some of that amazing advocacy and championing by the Senate and the House turned into law. And so that's where our work is cut out for us. It is not something that happens just because people see the light. It's something that happens because they feel the pressure. And so we as both the executors of science and the implementers of science, but also the advocates of science on behalf of patients and on behalf of the country's economy, we got to keep up the work.
Sudip, I'm going to come back to this issue of what can people do? How can they get involved in this in a minute? But embedded in all of this is also the indirects, the way universities recoup the expenses they incur that are not covered by the direct conduct of science. And I know there's a process called the FAIR process, and you're involved in that. So perhaps you'd want to give an update on where that is. I know it's controversial. There are things about it that some people like, some things about it people don't like, and so it's not a perfect solution. But people are working hard to find a way forward here. So tell us about that and where that's going.
Yeah, this model has been created called the FAIR model. It's been created by the Joint Associations Group, JAG for short. That's chaired by Kelvin Drogemeyer, who worked in the first Trump administration as the head of OSTP. And it was really done in response to a call to action by the appropriators in Congress. What they basically said is, look, we understand the need for indirect costs. We understand that there are costs that have to be spread out across an institution that are in support of the scientific enterprise. But the system that's in place today is not transparent enough, it's not simple enough, and it's not fair enough. And so can you all come to us with a recommendation that satisfies making the system more simple, more transparent, and more fair? And so these groups have come together, and they include the representatives of the institutions, the higher education community, also independent research institutes, also some members of industry and philanthropy, and others. I will tell you that AAAS is not a member of that group. We purposefully, we didn't feel like we had a dog to fight the dog in the fight regarding the details. But this is where I'll tell you, and this is me speaking personally now. There is a model that's been proposed by the JAG. It's called the FAIR model. And we are in a place where the appropriators are holding language open for this to go into to be implemented. Now, what they've said is the current model, the current status quo, is not sustainable. They will not defend that model in the long term. So the status quo is not an option. And so the FAIR model, which has been worked out by a lot of folks, it's not perfect. And I don't know the details. I'm not smart enough to understand where the details don't work for everybody. But what I'll tell you is this, is that we have this runway to get this implemented in this appropriation cycle. And if we miss that, then we are going to end up with a cap that is incredibly damaging to the entire scientific enterprise across the board. And that would be a disaster. And so my own recommendation to everybody is the members of Congress have told us if we keep hearing from individual institutions or individuals that they want to just tweak a little bit of the FAIR model, they're not going to deal with that. And they're just going to say, forget about it. And what they want is a community-wide support for a single thing. So let's not let the perfect get in the way of the good. Let's get this model implemented. And then next year, we can all go up there and try and change it as much as you want to. But let's get a model in place. Because if we don't, we're going to damage the enterprise. And it's a classic prisoner's dilemma, right? Each one of us acting on our own is going to cause damage. But if we act in concert, we're going to save the enterprise.
Thank you for that update. It's not reassuring on the one hand, but sometimes, as you said, it's not set in stone. Something is better than nothing, and there's a chance to continuously improve it. That leads me sort of to a related question, and in a sense, just really going back to this whole, budget. How do we advocate? Where do we advocate? And what are we advocating for? What is the best pathway for ordinary scientists who are, toiling away at their work, or early career scientists who are, focused on accomplishing their research agenda? What is the best way for people to participate in the conversation in a helpful way?
Yeah. Let me speak first to individuals, because there's a lot of folks here in Washington and elsewhere around the country that lead large organizations that are really collaborating and coordinating more than I've ever seen before. And I can talk a bit about that if we want to, but at the individual level, if you grew up in a place that is a place where the member of Congress from that district is someone who's maybe not supportive of expanding budgets for science agencies and for the NIH, speak up in that district, right? When you go home, go visit the member of Congress in that district. Go visit the staff in that district. They're gonna listen to you in the district, even more so than they're gonna listen to you here in Washington. Here in Washington, they're used to folks coming in all the time to talk about things. If you're from that district and you go into the office there, they recognize it's really important to you. You can do that as a patient. You can do that as a scientist. You can do that even more effectively when you do it together. But that's a great place to do it. I've watched these wonderful graduate students come together and write letters in their hometown. So they may be graduate students at elite universities and land grant universities and HBCUs around the country, but they're writing to their congressman from their home district and to their congresswoman from their home district. And that's incredibly powerful. Writing letters, op-ed letters in the local newspaper still has real power. And so I highly recommend that. The other thing you can do is share your story in places where you can slowly start to build relationships and change minds. And so that is in showing up for things and putting a human face on the sciences and on patients. That's a really powerful thing to do in the mid and long term. In the short term, in this appropriations process, that visit locally will make a huge amount of difference. And it's going to be coordinated with, and it's going to be in collaboration with the air cover that's being provided here nationally, right? Nationally, there are organizations like Research America that's right at the tip of the spear, like Act for NIH, like AAAS, and like many of the other patient advocacy organizations here in town. They are going to coordinate nationally, and they're going to provide air cover. But there's nothing better than seeing a constituent up front and up close in a local district saying, NIH matters to me. CDC matters to me. That is incredibly powerful. So please.
Sudip, earlier in our conversation, you made reference to the fact that the further we are immersed in our science careers, and maybe the longer we're immersed in our science careers, the further away we are from the things that motivate us to get involved in the first place. And, for me, that's bedside care of patients, having grown up in the HIV catastrophe in San Francisco at the very beginning of my internship. But, when we get back in touch with why is it that we do this work, and, obviously health and medicine research is just one of the pillars of science that we're talking about, but energy is an important pillar, data sciences and AI, we have many pillars, and yet we don't really put a very big emphasis on how we tell those stories. Our communication skills are not necessarily part of our graduate training. They are in some institutions or in some environments, but I think there's a real opportunity here for all of us to self-educate, but also to more meaningfully collaborate in ways to be more effective at bringing the excitement of science back to people. It's not just, I'm under stress, please let me tell you my story and, why you should want to invest more in NIH. This is really about how wonderful our work is. I sit, kind of looking over the fence at NIH, and I see the incredible science that's progressing in the institutes and the people they fund across our academic ecosystem. And I just, it just makes me so excited for the possibilities. And that's kind of the irony that we're facing. We have this incredible capability, but we have to treasure it and invest in it and treat it like the national asset that it really is. So I think the storytelling is important, but we want to make sure that we preserve and amplify the excitement of what we can do with the science tools that we have today. It's limitless. I really believe that.
It really is. I mean, you think about it, the science is at its absolute apex right now and its most fragile. It's both things at the same time. And you know, the scientists, the young scientists, the senior scientists who can communicate that excitement, that opportunity, and couple it with a patient and say, we are on the verge of doing something extraordinary here, and do it in an authentic way, right? I mean, you don't have to. We can all take communications classes and be better communicators, but your authenticity is what's so powerful, right? Talk the way you talk. I'm a big believer that if you try to be something you're not, if you try to be sound like a game show host as opposed to yourself, you're not going to get very far. But if you sound like yourself, and even if that is a little bit awkward, even if that is a little bit a little bit reserved, that's okay, because you know what, your enthusiasm, your excitedness at what's possible will get through when you do it in your own way, especially when it's, again, coupled. There's nothing more powerful than seeing a patient, a member of the scientific community, and a person from industry at the same time. That is an incredibly powerful trio. And I don't care how awkward you think you might be as a communicator. Those three come at you at the same time and tell you that, you know what, we're working together to do something extraordinary. I can't think of anybody that's going to say
it. It's powerful. It's amazingly powerful. And the other piece of this is beyond just the the professionals who are involved. It's also really about the democratization of science, and how do we, citizen scientists. If I could have time to write a book, it would be about citizen scientists, because I have seen the most amazing things when people who aren't trained as scientists get involved. They find a virus in their backyard, or they study these little creatures called tardigrades in the moss of their tree, or they discover a planet, or these things are now accessible to people everywhere. And I think as we build more of a community of interest, we can take away the elite dimension of science and help people experience it as something that's approachable and part of everyday lives that we all have a stake in and we all benefit from in really remarkable ways. And that kind of brings me to the last thing I really wanted to make sure we touched on, Sudip, because there was a recent executive order about gold standard science. And, that was specifically focusing on accessibility to the data that science creates in broader manner, but also the reproducibility of science. And then, at least from an NIH perspective, Dr. Bhattacharya has come forward with, how this would be implemented in the research framework. And again, I won't go into I think there are 9 tenets of the gold standard science agenda. These are all things that I'm sure the vast majority of people on this call would agree with in principle. A lot of work to do in fleshing out the details of exactly what would this mean, or what changes would be a consequence of this. But, in having an open mind and listening to some of the conversations about the culture of science, I do think that, I just mentioned the democratization of science, but I also think that the dogma of science is something that we have to be very alert to. And as you pointed out earlier, in the context of COVID, also very humble about. It's okay to not know. It's okay to disagree. It's okay to, stand up to something that someone's saying that you see differently or you interpret differently. We need to have that healthy discourse. Unfortunately, what the public is often subjected to are 2 talking heads on a television screen, nowadays sometimes even more, but one person who's really trying to do a good job of giving a fair and balanced picture of things, and one person who's totally nuts, and they're presented there as if they have equally relevant and equally valuable points of view. That has to stop. We really have to be able to expose the fact that science is about controversy. That's how science process is made. That doesn't mean that it's a fatally flawed system. It means it's a healthy, organic, growing environment. I don't know how you're thinking about that at Science, at AAAS, because, obviously that's a pretty central theme of success in what you publish and how you present controversies in science. But I think it would be worthwhile for people to just hear a little bit about your thinking and how you see this opportunity to better prepare the public for controversies and the dilemmas that science is experiencing without thinking that we don't know what we're talking about at all.
That's right. It's a real challenge, right? That last point you made is the thing that makes it so hard, right? Because once you start talking about the challenges that we all face, then the question gets asked, well, then what should we listen to from you all? And I think there's a lot that should be listened to. One of the things that at Science, our editor-in-chief, Holden Thorpe, has been really clear is that we should be open to the idea that we make mistakes, that science is done by humans, and that the scientific process is probably the best thing we've ever invented to sort of transcend the limitations of humans. We all have biases. We all want our theory to be right. We all want our hypothesis to be correct. And so science is the process of having an objective way to transcend those limitations. And I think when we do it right, it certainly is that. And the key is to create a culture that enables us to do that more of the time than not. And so, for example, sometimes scientists are not right. Linus Pauling, who famously, determined the structure of the alpha helix, was extraordinary. He also proposed a structure for DNA that was completely wrong. Now, we don't say bad things about Linus Pauling because he got that wrong. It was part of the process. And, about a year later, everyone knew that Watson and Crick were right. And we have a really long and fruitful discussion and an argument about it. This is going to happen throughout the rest of the future. This is the way that we do science. We have to be able to communicate that to the public in a much, much better way. Now, it's hard in a crisis, right? Because in a crisis, you're dealing with what are you trying to get people to accomplish today? And so we've got to start thinking about that while we're not in a crisis. We need to have investments in how do you communicate honestly and transparently and yet impactfully during a crisis. And there are people who are studying this and who are trying to make headway. The thing that I truly believe is right is that you are honest about when you've gotten something wrong and quickly fix it. In science, in the journal Science, we have increased the number of corrections and retractions that we have. And that is by design. We were trying, we want to make sure the scientific record is right. We want to have a very objective way of going about that. And it's not always objective, right? I mean, there are humans involved in these processes. And so when that's true, we try and write about it so that you have an explanation from our editors about what's going on. We publish papers that are about reproducibility. We actually had a paper recently published that is a reproduction of another piece of work. It was that important, and it made its way into the journal Science. When I think of the executive order and the policy making that's coming out of NIH, there's a lot there that I would agree with completely. Science has to be reproducible. Science has to have lots of integrity checks and to ensure that we're being honest with ourselves and with the data. That said, implementing that, there's a lot of devil in the details. And we as a scientific community and as a public have got to come together to say, what are the ways that we do this and who is the arbiter, right? And so we want to make sure that it's not a political process. We want to make sure that it's not a political person without expertise that is the final say on what is gold standard science and what is not. There's a lot of work to be done in the details. And so I think we as a community have got to ensure that we are commenting back to the NIH. And I want to, I appreciate that Dr. Bhattacharya has put out requests for information. We have to respond to that. We have to make sure that we're putting in our input into how to do gold standard science. This is an argument that's going to go on. It should. It should always go on. We're always going to learn more about how to do this in a better way. Let's do that in as healthy a way as possible, and let's be communicative as possible to the people who are paying the bills that what they're paying for is really extraordinary, and I know that it is.
Yeah, and at the end of the day, there are people who are waiting in the health sector for these discoveries,
We are.
but there are people waiting all over the world for science and technology to come forward and solve all kinds of problems. So I loved what you said about this is the apex of science, but it's also at its most fragile. And it's really up to us. We have to do a better job of embracing our responsibility here as much as we benefit from harvesting the opportunities that it creates.
Yeah.
So
And Julie,
Sudip,
one quick thing, we're not the only generation that had to do this, right? I sit in a seat that was once occupied by a guy named Phil Abelson. And Phil wrote a book called Enough of Pessimism. And he wrote it in the 1970s, right? Because he thought that the country was too pessimistic. He thought that we were failing ourselves. He thought that we weren't investing enough in science. He thought that we were going to do too much to cut the debt and hurt science. We've been here before, and we have to lead our way out of it. We have to push back. We have to advocate. We have to lead our way out of it. And I think I'm very optimistic that the community is going to come together to do that.
so Sudip, we have 3 minutes left. You get the last word. You know, when you sit where you sit, and basically you're seeing the universe of science from the pinnacle. Where do you see the greatest hope, the greatest opportunity, the greatest breakthroughs? You know, say in the next decade. Where would you place your bet?
I wish I knew. I always say that actually people ask me that question sometimes, and I have answers. I'll give some. But if I really want to know the answer to that, I ask a young person because, they will vote with their feet, right? They're going to go into if you're a graduate student today, I'm so jealous. I'm so jealous because you get to vote with your feet. You get to say, you know what? Yeah, sure. Everybody's working on that problem, but I see this thing over here and I think it's going to be really cool. And that is still an opportunity even today. When I look at science, when I look at what's possible, I talk about the idea that 180 years ago, Michael Faraday would talk about the fact that he's working with electrons and he was understanding electrons. And William Gladstone, the future Prime Minister of the UK, asked him, he said, "What good is this work that you're doing with electrons? It's kind of cool, but what good is it?" And Faraday had the best answer ever. He said, "I don't know, but someday you're going to tax it," which I think is like the best answer you could possibly give. There is still magic out there. There's magic out there, right? There are entire organelles in the cell that we're not completely sure what they do, right? We're not completely sure what they do. In the same way in physics, we know that the standard model of physics is wrong. And what that means is in biology, there's still magic out there. There's still magic still to be discovered. We know so little. We are 70 years out from understanding the structure of DNA, like the most basic possible thing. So there's still magic to be understood, and that magic can be turned into progress for humanity. It can be turned into living longer, healthier lives, and it can also, in the world of physics, it can be turned into cool stuff like electricity. I have no idea what gravitational waves are for, but someday it's going to be something really cool, and I know we're going to tax it.
That is a great way to end this discussion. I really thank you, Sudip. You're amazing. We're fortunate to have your experience in leadership helping us move forward in our science world. So thank you. And thanks to everyone, and particularly Research America. And back to you, Sheila, for closing us out. Thank you.
Thanks, Julie.
That was a great discussion. Thank you both so much. And I know our audience got so much out of this. So thanks so much for your time. And I could sit here and listen to you the rest of the afternoon. Before we go, I'd like to remind everyone who's in the area, or even if you're coming to the area, that our next session of the National Health Research Forum will be next Wednesday, September 17th at the AAAS headquarters in Washington, D.C. And we're going to be joined by Dr. Bhattacharya, who we've talked about a fair bit today, the NIH director, who is going to give a keynote address. And we also have a really great lineup of programming focused on some recent polling that we've done. And there's still time to register, and you can find out more details by following the link in the chat. Thank you again to our sponsors, and thank you all for joining, and thank you to our speakers, and have a great afternoon.
Thank you.